Disclaimer: We Level Up is not promoting the use of gabapentin. This video explores dangers and consequences, not endorsement. Learn, don't use. Comment below. Stay safe. Welcome to the We Level Up Treatment Center video series. In today's video we will discuss Gabapentin ruined my life. What is gabapentin? Gabapentin, known as Neurontin, is a medication commonly prescribed for treating epilepsy, neuropathic pain, and anxiety disorders. Over the years, it has become increasingly popular as a treatment for various conditions, including migraines, restless leg syndrome, and fibromyalgia. However, as with any medication, gabapentin is not without its side effects. While many people can take the drug without any issues, others may experience adverse effects that can significantly impact their quality of life. Is gabapentin addictive? Gabapentin is a medication that has become increasingly popular in recent years for treating various conditions such as epilepsy, neuropathic pain, and anxiety disorders. However, there has been growing concern about the potential for gabapentin addiction. Gabapentin addiction, also known as gabapentin use disorder, is a condition characterized by compulsive drug use despite negative consequences, such as social, occupational, or health problems. While not everyone who takes gabapentin will develop an addiction, evidence suggests that the drug can be habit-forming for some individuals. One factor contributing to gabapentin addiction is the drug's ability to produce a sense of euphoria or relaxation. Some individuals may take gabapentin to self-medicate for anxiety or other conditions and may find that they enjoy the drug's effects, leading to continued use and potential addiction. However, there is also evidence to suggest that gabapentin can be useful in treating addiction. Research has shown that the drug can be effective in reducing withdrawal symptoms and cravings associated with opioid use disorder and alcohol use disorder. This is known as gabapentin for addiction, and it is one of how the drug can be used to help individuals struggling with substance use disorders. Despite its potential benefits in treating addiction, it is important to note that gabapentin can be addicting and should be used cautiously. Individuals with a history of substance use disorder or addiction may be at increased risk for developing an addiction to gabapentin. If you are concerned about gabapentin addiction, seeking help from a healthcare provider or addiction specialist is important. Treatment for gabapentin addiction may include medication-assisted treatment, behavioral therapy, and support groups. In conclusion, while gabapentin can be helpful for the treatment of certain conditions and addiction, it is important to be aware of its addictive potential. If you or someone you know is struggling with gabapentin addiction or any other substance use disorder, seek professional help to get the support needed to overcome it. How long does it take to get addicted to gabapentin? Gabapentin is a medication used to treat various medical conditions, including seizures, neuropathic pain, and anxiety disorders. While the Drug Enforcement Administration, DEA, does not classify it as a controlled substance, some individuals may still become addicted. The question of how long it takes to become addicted to gabapentin is complex, as many factors can contribute to the development of addiction. Some individuals may become addicted to gabapentin after using it for just a few weeks, while others may use it for years without developing an addiction. It is important to note that while gabapentin is not classified as a controlled substance, it does have the potential to be abused and lead to addiction. Some individuals may misuse the drug by taking higher doses than prescribed, taking it more frequently than prescribed, or using other substances to enhance its effects. Additionally, individuals with a history of substance abuse or addiction may be at a higher risk of developing an addiction to gabapentin. This is because the drug can produce feelings of euphoria and relaxation, which can appeal to individuals seeking to escape emotional or physical pain. It is also important to note that gabapentin addiction can seriously affect an individual's health and well-being. In addition to the potential for overdose, long-term use of gabapentin can lead to physical and psychological dependence and a range of negative side effects. While gabapentin addiction can be a serious problem, it is treatable. Individuals who are struggling with addiction to gabapentin can benefit from a variety of treatment options, including behavioral therapies, medication-assisted treatment, and support groups. In conclusion, while gabapentin is not classified as a controlled substance, it does have the potential to be addictive. The question of how long it takes to become addicted to gabapentin is complex and depends on various factors. If you or a loved one is struggling with addiction to gabapentin, it is important to seek professional help as soon as possible. Gabapentin side effects. Gabapentin is a medication commonly used to treat various medical conditions, such as seizures, neuropathic pain, and anxiety disorders. While it is generally considered safe and effective, there are some potential side effects that users should be aware of. The most common side effects of gabapentin include the following. Dizziness or drowsiness. This is one of the most commonly reported side effects of gabapentin. Users may feel lightheaded, dizzy, or sleepy after taking the medication. This can be especially dangerous if the user drives or operates heavy machinery. Fatigue or weakness. Some users may experience feelings of weakness or fatigue after taking gabapentin. This can make completing daily tasks or participating in physical activities difficult. Nausea or vomiting. Nausea and vomiting are common side effects of gabapentin. Users may feel sick to their stomach or experience stomach pain after taking the medication. Headache. Headaches are another common side effect of gabapentin. Users may experience mild to severe headaches that interfere with their daily activities. Dry mouth. Gabapentin can cause dry mouth, which can be uncomfortable and increase the risk of dental problems. Swelling in the extremities. Some users may experience swelling in the arms, legs, or feet after taking gabapentin. This can indicate an allergic reaction or a more serious medical condition. Mood changes or depression. Gabapentin can cause changes in mood or feelings of depression in some users. This may include feelings of sadness, hopelessness, or anxiety. Difficulty speaking or slurred speech. In rare cases, gabapentin can cause difficulty speaking or slurred speech. This can indicate a serious medical condition and requires immediate medical attention. Coordination problems. Gabapentin can interfere with coordination and balance, making it difficult to perform daily activities. Memory or concentration difficulties. Some users may experience memory problems or difficulty concentrating after taking gabapentin. This can interfere with daily activities and lead to frustration or stress. Unusual eye movements. In rare cases, gabapentin can cause unusual eye movements or nystagmus. This can indicate a serious medical condition and requires immediate medical attention. Allergic reactions. Some users may experience allergic reactions to gabapentin, such as hives, rash, or difficulty breathing. This requires immediate medical attention. If you experience these side effects, you must talk to your healthcare provider to determine the best action. Sometimes, adjusting the dosage or switching to a different medication may be necessary. It is important always to take gabapentin as directed by your healthcare provider and promptly report any side effects or concerns to them. Gabapentin addiction treatment. Gabapentin addiction is a serious problem that can significantly affect an individual's health and well-being. Fortunately, various treatment options are available for individuals struggling with addiction to this drug. The first step in gabapentin addiction treatment is often detoxification, which involves safely removing the drug from the individual's system. This process can be medically supervised to ensure the individual's safety and comfort. Once detoxification is complete, the individual may benefit from various behavioral therapies, such as cognitive behavioral therapy, CBT, or dialectical behavior therapy, DBT. These therapies can help individuals identify and change negative thought patterns and behaviors, develop coping strategies for managing cravings and triggers, and improve their overall emotional and mental health. At our Dual Diagnosis Treatment Center, We Level Up can implement the highest quality of care. Accepting that you may be living with a mental illness can be challenging. However, treating the presenting substance abuse case can be magnitudes easier once properly diagnosed and treated. Only a properly trained medical professional can diagnose these underlying conditions. If you believe you are suffering from a disorder alongside addiction, we urge you to seek a qualified treatment center to begin your journey to recovery. Call We Level Up today. That's it for today. Please subscribe and hit the notification bell. Like, share and comment. We would love your feedback. Have a great day.